There are conversations about food, conversations about cars and conversations about clothes, people, work and weather. Then there is the conversation about what would happen if you became ill and could no longer tell anyone what you want for yourself. A nationwide Conversations That Count Day has been organised to urge people to do that now.
People commonly think that end of life is about I've got cancer or I've got a lung disease or a kidney disease, and that is true, as well as people whose health changes suddenly, like through a stroke. And it's about thinking about, if I ended up having a stroke and couldn't speak for myself, what's acceptable to me.
The idea is to develop a plan that can be stored in a patient's medical records to help health professionals make decisions on treatment.
Do I want to have antibiotics, for example, if I get a big chest infection when I've had a stroke and I can't feed myself or look after myself?
It could start with something as simple as a quiet family chat.
That's as much about sitting around the tea table tonight and talking to those who live with you about what's important to them. If not just for end of life, but if I knew that I had an illness that I wasn't going to get better from, what are the things that are important to me and what's not?
The day is being organised by the National Advanced Care Planning Cooperative, with events across New Zealand and a website where people can send postcards to friends and family to help them start the conversation. And while the subject of those conversations will be slightly more grave than a holiday snap, nothing can be more certain, aside from taxes, that they one day will be very relevant. David Lockray, 39, Dunedin News.